Hello, everybody out there in YouTube land. My name is Jack, otherwise known as the Cyberspace Cowboy, and I'm here to talk a little bit about my experience with the Veterans Administration medical care. Now, I served my time, did 2 tours of duty in Vietnam, and came back and applied for medical care back then. For a couple things that I felt the Navy was responsible for doing. And of course, I got denied back then. But along the way, they gradually came around, and pretty soon I received what I have now is a 20% disability rating, and I won't go into the medical history and tell you what it's for. But it is a current rating. However, I used the VA very sparsely in my younger years. I used it once when I was living in San Diego. A friend of mine's cat was playing around and scratched the back of my head. And when cats get dirt and other things under their claws, there's a bacterial infection that happens, and it's known from the Ted Nugent song as cat scratch fever. It's actually fairly serious. It causes your lymph nodes to swell up. And at that time I had no insurance, so I went to the VA hospital in San Diego and was treated very well there, quite surprisingly. And it was there that I first noticed the trend in the patients. I received excellent care there. Doctors were fairly young. It was next to UCSD, which is the University of California, San Diego, and they have a very large medical school there. The building at that time was pretty much brand new, and the doctor was also probably fairly newly minted, but they talked to me. They told me everything they were doing and why and how, and they were very responsive to me. The nurses took good care of me. They made sure I was comfortable. Then for years after I got some better jobs and got health insurance, I started paying into that. And quite honestly, my medical care through my private insurers and through private doctors and hospitals hasn't been as good as it's been with the VA. In fact, it's been worse in some cases. I have been misdiagnosed on things several times under my private insurance. My ex-wife worked at a hospital, and one of the doctors there misdiagnosed some things with me. It wasn't until I went back to the VA in Northwest Indiana that I finally started getting the care that I thought I deserved. And ever since then, I've been to the VA in Northwest Indiana. I've been to the VA in Syracuse, New York. I've been to the VA in, I think it was East Orange, New Jersey. And I've been to the VA in Danville, Illinois. And now I'm going to the VA here in Lafayette and down in Indianapolis. At every VA I've been to, they know my name. They know what I'm there for. Every time I've walked into a doctor's office through private insurance, it's, who are you again, and what are you here for again? I have found the doctors in private practice to be, for lack of a better term, prima donnas. Overpaid prima donnas, pretty much. Found it just as hard to get an appointment with various doctors on the private side with private insurance as it has been with the VA. But the VA has taken better care of me. And then I began to ask why. In the primary care business, and it is a business, hospitals have bought up doctors' practices. They buy them and then give the doctors special privileges at that hospital. Unfortunately for me, with my health care, whenever the employer decided to change healthcare providers, it usually changed the hospitals I was able to go to and the doctors I was able to see. So I didn't have consistency in doctors. With the VA, yes, they've gone through a few doctors, but the place is consistent and the staff is consistent. They know who I am. They know what I'm there for. They know how to treat me. In doctors' offices in the private sector, they are no longer considered doctors' offices by the hospital administrator. They are considered profit centers. And when you are a profit center, you have to see as many people in one day as you can to justify your overblown salary. So you hire PRNs, and there's nothing I have against PRNs. My doctor at the VA is a PRN, and she's wonderful. But the doctor's office, if you sign up for a doctor that everybody says, oh, he's so good or she's so good, I've never seen the doctors. I've seen their staff. I've seen their nurses, their PRNs, anybody but the doctor. With the VA, I see my doctor. At the private insurers, they have to see X number of people a day. It can be as many as 250 patients a day, charging them $40 a crack on your end and getting probably the same from the insurance company on a monthly basis. And so they shovel these people through. Doctor gets his payout. The hospital gets their cut. And they make money on it. Big money. Hospitals aren't there for the medical care anymore. They aren't there for your benefit anymore. Private hospitals are there to make money, whether they are for-profit or, quote, non-profit. They're there to make money. You look at some of the Catholic hospitals in the system that my family has worked for, they're putting in marble floors. They're making the place look like a hotel. I had one place up in Crown Point, they imported Italian marble for their brand new entrance. 6 months later, they added a whole bunch of more doctors, and they needed to add another wing for the doctors. Guess what they tore up? The imported marble flooring, and they tossed it. And at the time, they told their employees, oh, we can't afford to give you a raise. That's a nonprofit. At the VA, they are only required to see one patient every half hour. One patient. That's why it's so hard sometimes to get in to see them. It's not because there are too many patients. It's just that they don't have that push that they have in the private sector, where you're just a number and they're going to push you through as fast as possible. I have never been to a private doctor's office and seen the doctor for more than 5 minutes. I've spent the entire half hour with my doctor at the VA. So those people that say the VA sucks, you're full of crap. What sucks at the VA, and this is something I mentioned in the beginning, was what the trend I noticed in the patients. The patients suck. They're entitled. They're angry. And they want things done right now. Take care of yourself, veteran. Stand down. Take a look at what your lifestyle is and work with the VA to be a little bit more healthy so that you don't have that sudden pain in your chest and go calling up the VA and they say, well, we can get you in next Tuesday, otherwise you can go to an urgent care. Take care of yourself. They've got the MOVE program. They can get you discounts at gyms. They will work with you with a dietitian to help you to lose weight. They will work with you to make sure you maintain a healthy lifestyle so that you don't have to go running to the doctor every 2 or 3 days and take a buttload of medications. Now, I'm taking a number of medications myself. I've had some symptoms that have arisen in the past few months. But those are going to go away. They're going to go away. But my doctor calls me and says, how are you doing? How are the medications working? Why? Because I'm nice, I'm polite, I don't get upset easily, I talk calmly to them, I don't bitch about my health. I write down things that I want answered, and I go through them. And they have answered every single one of my questions. Every single time. So, veterans, change your attitude. Change your attitude when you go in there. Don't go in there itching for a fight. I've also watched veterans standing in line on a Sunday morning at the pharmacy at a VA hospital, bitching because it's taking so long. There's one pharmacy tech there and one pharmacist on a Sunday. But they're taking so long. Yeah, they're taking a long time. They have to fill your prescriptions and all the others that they have that have been sent in via the interweb or called in or what have you. You're not the only one there. Get a life. Learn to have some patience. Remember the old military motto, hurry up and wait. Stand down. Thank you.